Okay, good morning. This is Edward Ng with the Pittsburgh Foundation. Just wanted to let everybody know that we are recording this session and it will be available for download or rebroadcast at a later time. Please hold all your questions to the question box. We will answer them after the webinar is over in an email. That said, I'll hand it over to Phil Koch.
Hey, thanks a lot. Appreciate it, Edward. Phil Koch of the Community Foundation of Westmoreland County and the Pittsburgh Foundation. Good to be here to meet with you all to talk about the response to the pandemic and what each of us are doing in our individual areas to support each other and to make sure that folks in our community are taken care of. I want to start by acknowledging by thanking the Westmoreland Museum of American Art for this great painting that they've given to us as our resting slide. This actually is entitled Panther Hollow, and it's by artist Everett Longley Warner. And it's his interpretation of the neighborhood in Oakland section of Pittsburgh as a light and vibrant winter landscape. Warner's painting is about the effects of light, color, and atmosphere. The billowing smoke from the train softens the entire scene, illuminated by the afternoon sunlight. It's got to be my favorite thing I do every month is to describe this artwork. Anyway, thank you again to the Westmoreland Museum of American Art. We're going to move right into why we're here and hear from our panelists today. We do have Alyssa Chilodowski, who hosts this call with me from the United Way, as well as Sarah Stanger, who's with the Westmoreland County Behavioral Health and Developmental Services. But we also will hear from Commissioner Chu, as well as Dr. Fox. Bud Mertz is here, as well as Dr. Conway from the IU, Jennifer Miller with the Food Bank, Deb Thacker with Feeding the Spirit. We also have Dan Carney, who will be joining us from Union Mission to talk about housing. And finally, we'll round that out by hearing from Jordan Paletto from the Hill Group, who will talk about the human services study that's being spearheaded by the United Way. So I'm going to start by passing it on over to Alyssa.
Thanks and good morning. I have a couple things that I wanted to bring forward to the group. The United Way has been doing what we're calling the Community Pulse Report, and this is in cooperation with the Poise Foundation and Allies for Children. And we're looking at the impacts of COVID-19 on a lot of different environments, health and well-being, children and families and such. And so I wanted to just quickly go through a couple of the things we found from the last report, which was November, December. And if anyone is interested in a copy of this, I'm happy to forward it after the call. So in the aging and Black and Asian community is where we're seeing the most spikes in COVID-19. I don't think that's surprising to anyone, but we're also seeing a huge impact in mental health. In fact, 53% of the adults in the United States are reporting difficulties with their mental health and concerns about the impact. Also, something that has popped up is youth unemployment is extremely high, and this is both for kids who are coming out of high school, going into the workforce, and then those also trying to work while they're in college. It's just been very difficult, and that's going to be something I think that we're going to see the effects of it after we get through the COVID era, hopefully. But really re-engaging those youth in getting them jobs or training, really quickly so that they don't continue this downward spiral. The impact on seniors, it's been huge, facing significant health concerns, social, emotional. The isolation, especially for those who are living on their own or in a facility who haven't been able to visit with family, that's been really something of concern too. One of the other big things that we're noticing is the impact on women in the workforce. 38% of women have had to change their job or reschedule their hours, mostly due to childcare concerns, homeschooling and such, and then the impact of childcare facilities being closed. Actually, United Way is doing a program next week called The Question Before Us, and we're going to dive deeply into this with some experts in the area who are going to talk about what can be done and what's happening with this. That's next Wednesday, January 20th. So on to the 211, as has been through this whole pandemic, we are seeing the calls continue to go up. In Westmoreland County alone, there was over 1,200 calls to 211 in December. I'm just looking at the statistics now. 50% of those calls were for housing and shelter, and of those, about 87% were asking for rental assistance. And that's just been something that has been on our minds, and hopefully we can come up with some solutions to that. It's really a problem both for the people who are unable to pay their rent, and then the landlords who rely on that income as well for their families. Food calls, people are still asking where the nearest shelter is. In utilities, mostly it's electric help. Healthcare, 60% of the calls have been asking about COVID-19, where to get tested, whether it's symptoms, treatments, all those kind of things. So you can see from the variety of calls and the concerns that 211 has just been a great resource. I'm happy always to be able to support that. And I know it's because of the information that our partners and other people put into the system that we're able to help people when they call. So that's what's been happening in United Way land.
All right.
Happy always to answer any questions, provide more information. Thank you.
Thanks, Alyssa. I appreciate that. Let's move on over to Sarah Stenger with the Westmoreland County Behavioral Health and Developmental Services. I know that, I know we have a chart that's uploaded with the numbers on the next slide. And we can also send this chart out to the group later on if it's a little hard to see, but I'll pass it over to you, Sarah.
Hi, good morning, everyone. Yes, the chart is updated best we can. Some information we don't get because there is a delay in reporting. But some of the areas I did want to touch on for December was the 302 calls to our office. In December of 2019, we saw 79. In December of 2020, we saw 90, so we did have an increase there. Also with crisis calls to the 1-800 hotline through Westmoreland Community Action, there were 534 in December of 19, and there was 802 in December of 2020. We also are seeing an uptick in medical assistance enrollment for the county. Last year in December 19, we had 59,046 people, and this year in December 20, we had over 67,000. So we did see a significant increase there for who was eligible for services. I guess I can report a little bit on the drug and alcohol numbers too. I don't believe Colleen's on there. When I was looking at this information, the numbers have gone down for drug and alcohol services. For the jail referrals, last year we saw 76 referrals. This year they are reporting 26 referrals. So there's a significant decline with those seeking services in the jail. Also in the community, last year we saw 90 referrals through December, and this year it was 51. For drug and alcohol on the different inpatient units, last year they saw 104, and this year was half of that at 51. And for outpatient referral for assistance, last year was 49, and this year they were seeing 22. So there was a significant drop in those seeking services for the drug and alcohol world. A couple other things I wanted to touch on from our office that we're working on. We were able to use retained revenue money to start a CIT group. This is for the community, for police officers to get training for mental health, dealing with people in the community. It's a 40-hour training for a week-long certification training that officers go to, where our office is, well, not our office, but the funding is able to provide a reimbursement for the officers that attend that training. So it is a very well put together plan. They see significant differences in the community. They visit centers. So we're trying to plan that as best we can. We have to have that money spent by the end of June. It is different with everything the way the world is right now, but normally it's a Monday through Friday class that they have to attend. So we're trying to see how we can better plan with that. Also, the coroner had some final statistics, and I just wanted to touch on for the suicides last year. Our office supports the Ray of Hope Task Force through Mental Health America. Last year, our numbers were down, or this year, our numbers were down. I'm sorry. Last year, we saw 51 completed suicides, and this year, so far reported, there were 45. So those numbers are slightly down. I just wanted to make aware too, if anybody is in need of services, we continue to offer the Ray of Hope's support group through Mental Health America. It's on the first Tuesday of the month. So that is something, if you need more information, please reach out to me or Mental Health America. We do want to support the community with those efforts, and we still keep planning for different things to happen in the upcoming months. We are looking to start to ramp up some mental health services. We're looking to talk to a couple providers about expanding services. Hopefully we can continue to meet the needs of the community and offer what levels of care are needed. I think that's all I wanted to report on.
Great, thanks, Sarah. I appreciate it. And again, we'll get this these indicators out to folks so that they can dig into the numbers themselves, and you know, because I know it's a little bit hard to see on the screen, but appreciate the overview. We're going to move now to Commissioner Chu. Commissioner, I wanted to make sure that you're with us today. I believe you are. Are you there?
I'm here.
All right. I'm going to pass it over to you then if you have any updates from the county that you think are pertinent.
Sure, thank you. Happy New Year to everybody out there. 2021 hasn't gotten off to the best start, but there's 355 more days, so hopefully we'll get improved. In terms of the CARES Act funding, which the county was distributing out to businesses, nonprofits, and other groups, our allotment of that funding is now expended. There is unknown, it is unknown whether we'll have any funding for the future, but as of right now, our current block is expended. We are getting a lot of calls at the county level where to get vaccinated. Unfortunately, I know probably as much about the vaccination plans as anybody in the general public. So hopefully, if there's questions on vaccination, Dr. Fox or Bud Mertz would have more information. The county government has not been given much information, more than what is in the news. So we know what phase we're on, but that's about it. And we're trying to get increased information from the governor's office. The courthouse is still operating on appointment only. So we're preferring that people make an appointment in advance before they come to the courthouse to minimize contact and keep social distancing as much as possible. Masks are required. Lastly, I wanted to touch upon something that's important to me. I know Alyssa had talked a little bit about rental assistance and the moratorium on evictions ending. Housing is a very important issue for me, so I'm always on the lookout for potential funding for Westmoreland County. We did find some funding last week. We got the application in. It was a rather quick turnaround, and as of today, it looks like there's approximately $10.4 million coming to Westmoreland County for emergency rental assistance. It'll be spent in 2021. I don't think the program will be extended beyond December 31st. And as of this morning, we're considering working again with Union Mission to put this into place. I know that there was some concerns for the program in 2020 that it required some things of the tenants and some things of the landlords that made it challenging to get the money into the right hands. But this program is a little bit less restrictive. And so hopefully we'll be able to get a larger percentage of this $10 million out into the public's hands so that people can maintain a roof over their heads. We actually only gave out about 40 to 60% of the money that we had in 2020, and a lot of people were saying that that was based upon I'm sorry about that. The challenges that the program created for people completing the paperwork. So hopefully this will have less challenges and we'll be able to get more of that money out. And that's all that I have today to report on, Phil.
I appreciate that. Thank you, Commissioner Chu. And I know that Dan, who we'll hear from a little bit later, has been working with some regional partners on that rental assistance funding that you're talking about as well. And I know I've been working with them as well to try to make sure that we advocate for less restrictions to get more funding out. And just one quick note is that if that 10 million, my understanding of the funding that's coming is that the 10 million that is coming to the county for rental assistance, once those funds are expended, that there could be additional funding at the state level if you can prove additional need prior to the end of the year. So I'll make sure that I talk to Dan about that, and we all coordinate to make sure that we get as much of those funds in the hands of folks that need it as soon as possible. So thank you, Commissioner. Appreciate it. We're going to move on now to Dr. Fox. Thanks for joining us from Excella Health. Dr. Fox.
Good morning, everyone. I thought I'd start out giving you a little bit of a perspective on where we're at currently looking at the numbers. And I'm going to be talking about Excella Health numbers, but I think they're fairly reflective of the overall numbers in our community. Currently, the positivity rate for the month of January is 27.6%. Our overall positive rate is 19.3%. So it is a little bit higher in the month of January. However, it's lower than we experienced in November and December when we were in the mid 30%. So I think that is definitely an improvement. And when you look at the rate over 14 days for the county and normalized by 100,000 population, our number today is 913, and that's compared to 1 month ago when it was 1,289. So a significant improvement there. Doesn't mean that we're out of the woods, but it's definitely a much lower number. For us, about 35% of our acute care beds are caring for COVID-19 patients. So it's still creating a significant number of cases within our buildings. We do have adequate ventilators. We have adequate PPE for our staff. We have, however, created some extra beds and units at all 3 of our hospitals in order to accommodate these patients. So again, we're certainly not out of the woods as of yet. Our biggest challenge has to do with having adequate staff, having staff who are either quarantined due to exposures or becoming ill themselves. We're very hopeful that, the advent of the vaccine will be helpful to us. And we are into the second shot for our employees. In terms of looking at surges related to the holidays, I do think we're getting past the Christmas incubation period. And, we did not see a big surge related to Christmas itself. And I do believe that's because people were heeding the recommendations and not gathering with family and friends. I think particularly because the Christmas holiday, traditionally people are spending time with elderly relatives and our youngest relatives. I think people were concerned about those vulnerable individuals. We still have a little bit of ways to go till we assess the final impact of New Year's. Of course, New Year's is a little bit more of perhaps a young person's holiday where, people do tend to gather in groups. So I think if we can get to this time next week and not see a large surge, I will feel much more comfortable. I know Commissioner Chu mentioned vaccines and, needing information. And I think we all could use some additional information. And that's something that we're all working on individually as well as collaboratively in our interactions with our legislators at the state as well as the national level. We are currently immunizing members of the 1A population, which are largely healthcare workers. Excella has had an acceptance rate of our employees of about 70%, which is a good percentage. Obviously, we'd like it to be 100%, but we're nearly through those individuals and have expanded to healthcare workers in the community. We think that by the end of our second wave of vaccines, we were able to get a second distribution from the state, that we will probably be able to hit probably 75% of the healthcare workers who are interested in receiving the vaccine. Really what's unknown at this point is what happens next. We know that next is the 1B population. The 1B population includes essential workers, which would be firefighters, police, funeral directors, coroners, teachers, critical utility workers, grocery workers, and then some other patients. And I say then some other patients because it's a little bit unclear. The Commonwealth has identified individuals over the age of 75. The federal government has identified individuals over the age of 65. So we're not entirely sure how that will play out here in the Commonwealth, and we're not sure about the next step logistics. I have been in touch with the Department of Health as recently as yesterday, and there's still not a well-defined plan at this point. We are hopeful to be able to obtain vaccine to be able to distribute via our primary care offices, because we believe that that'll be the best opportunity to get to a large number of patients if we can do it in a distributed manner. That would require getting the Moderna vaccine. Currently we use Pfizer. That's what we've been allocated, and Pfizer does have some very stringent storage requirements, whereas Moderna can be stored in a conventional freezer or refrigerator. So we do have some plans. I've been in contact with Director Mertz. We'll be getting together with folks from his office and folks from Excella next week, because we want to be prepared in the event we are allocated additional vaccine that could be used in larger clinic type settings, you know, beyond just a primary care office. So I wish I had more detail for you at this time. Unfortunately, I don't, because it is a very fluid situation, but we are immunizing individuals who are healthcare workers outside, you know, beyond the walls of Excella. And, you know, by the end of our allocation, we will have distributed about 50% of our total allocation outside the walls of Excella. So we are meeting the 10% requirements of the state. I'm sure we'll miss some people, but we're doing the best that we can. And, you know, if you have questions, you know, please filter them through Phil and the foundation, and we'll do our best to answer them for you.
Thank you, Dr. Fox. I know that lots of folks were really interested in hearing, especially that report on vaccines. And I know that you didn't have as much information as you would like, but it was certainly more information than we had. So I appreciate that. Thank you, Dr. Fox.
Yeah, and I do want to just say one more thing, and that is, as a reminder to everyone here, we need to continue wearing masks. We need to continue social distancing, even once people have had their full series of vaccine and are 14 days out, which is the point at which we expect immunity to develop. It's still not known whether an individual who has been immunized and has immunity themselves still has the potential to spread COVID-19 to others. That's why it's so important to wear those masks. So I just wanted to make sure I said that.
Thank you. Thank you for that reminder. Let's go ahead and pivot over to Bud Mertz. I know that you've been working hand in glove with Dr. Fox, but any update from public safety?
Good morning. Yes, thank you very much again for the opportunity and for this group. So yeah, I'll talk about the vaccines here right at the end, because that's probably going to be the longest. Just to let you know, first of all, our numbers are mirroring what Dr. Fox reported as far as the hospital numbers go as it relates to the 911 calls. January, we've seen a slight drop in our EMS calls, and of that percentage, a slight percentage drop in those that are being screened for COVID. So that's a good sign. Again, fingers crossed that we can do it. I mean, that's a very important statistic as far as what we're trying to watch, because it's talking about the availability of ambulances. Basically, the more EMS calls you have, the more ambulances that are on the road. The next call, that ambulance might not be there. So it's a good thing that those numbers are dropping, allowing the proper care and the proper dispatch of the calls that we do have. With that being said, we continue still all the tactics basically from the start of this back in February and March. We've expanded an awful lot. We will be working with Dan Carney coming up shortly with a PPE mission for out of the CDBG grant monies that they received. And so we look forward to expanding our mission that way to help those that most need it and don't have the opportunities. Yeah, I just went out my mind here. The Michelle that works for us that does the outreach to the nursing homes and personal care homes, she's doing an awful lot of extra outreach with them to try to help them through the vaccination process. And she's working with them, trying to make sure that they are getting scheduled, and that as you know, the nursing homes and the personal care homes are all part of the 1A. Out there someplace, there's probably a pharmacy that has some type of contract to do those, and we're assisting them as well, trying to push them through. Like everybody else is saying, as far as the vaccination, and it's very difficult for me being an emergency management planner for most of my life, that I don't know what the plan is, and it's difficult. But without a plan, as we handled everything else, when we have barriers in front of us, we find a way around them. And as Dr. Fox says, we're going to be meeting with Excella Health next week, trying to come up with some type of a plan. It's important for us, I believe, as we look at the pharmacies that are going to be allocated the vaccines, as well as the health system. It's important for us to somehow try to coordinate that they work together, complementary, instead of having a clinic here and a clinic there next door to each other and conflicting. So I think it's going to be a challenging role for public safety to be a part of that, if there is a place for us. They're not giving us the vaccine. So, the people that have the vaccine, are the ones that do have the control of it. We're trying to diplomatically work with everybody so that it's more coordinated in the county and we get the best results. The phases in the vaccination, I say, is really important at this point. Obviously, I've seen it in the past few months. We've had police departments go shorthanded. We've had fire departments go shorthanded, working with mutual aid systems because of outbreaks in their areas. I've had, the 911 center, having outbreaks there as well and go shorthanded, to the point that, we want to make sure that the care is available to the public. And as you go, obviously 1A with the healthcare worker, that's the highest and most important. They're the most at risk. But as you go into the other public safety entities, I think that's very important too. And so another challenging part of us is trying to figure this out and coordinate it, that we get the police departments and the fire departments vaccinated as well. But that's about all I have right now. Hopefully more to come.
All right, thank you, Bud. I appreciate it, and appreciate your work on that. I'm sure it is frustrating not having a full plan, but I know you'll figure it out. You always do. I'm going to go ahead and switch on over to Dr. Conaway to hear a little bit about our education system and how things are going.
Sure, thank you very much, and thanks for the opportunity to share an update. Late last week, the Department of Health and PDE did update their guidance for school districts, specifically for those that are in counties labeled as substantial. They eased the recommendations to allow districts in substantial to and recommending that elementary schools go into a hybrid model where maybe 2 days on, 3 days off, or remote. And many of our school districts are moving in that direction if they haven't already begun to offer in-person instruction. And that change is effective the beginning of the second semester. So many of the second semesters are the week of the 18th or soon thereafter. Also part of the updated guidance is that districts are allowed to identify targeted populations to bring in for in-person instruction as well. So students with special needs, specific grade levels, those students that may not have internet access or reliable internet access. It's a local decision of what's considered a targeted population. So again, our school districts are beginning to look at ways in which to identify targeted populations and bring those students for in-person instruction. And that in-person instruction could be 5 days a week as part of those recommendations. So you'll see a lot of movement in the school districts over the next 2 weeks when it comes to offering more in-person instruction. With that, in offering in-person instruction, the districts do have to sign off an attestation form that identifies that they will be following the face covering order of the secretary, as well as following the school closure charts, where depending on the level of infection and depending on the number of students in a rolling 14-day period, determines how many days a school should close down based on those cases. So those who are offering in-person instruction must sign off on that attestation form and submit it to PDE. Second part, as we've talked about vaccinations, part of 1A are school nurses, and so there's been many correspondences that have been sent out to the school nurses in the county, encouraging them to sign up for vaccinations wherever they can find them. And then, of course, as it's been mentioned, educators are part of phase 1B. So we're kind of waiting to see what the plans are for that. I know in other parts of the state, they are vaccinating educators and or moving into 1B, but it really depends on the access to the vaccinations and those institutions who are offering it. I will say that the intermediate unit is more than willing to be at the service of anyone to collect data when it comes to vaccinating educators in terms of collecting data from the districts, helping to identify who would like to be vaccinated, and also working with the districts to coordinate educators to be vaccinated. So the intermediate unit is very willing to assist in that effort if called upon. With that, Phil, that concludes my report this morning. Thank you.
All right, thanks, Dr. Conaway. Appreciate that. Let's move over to talk a little bit about food and housing. Let's move to Jennifer Miller at the food bank.
Good morning, everyone. Basically, 2021 so far kind of looks like 2020 did here at the food bank. One thing that is changing is that we are moving back to our former way of distributing food to our pantry sites, which means it's still going to be modified in terms of we'll be providing boxes to our pantry sites to be able to pre-box the food on site. Some of our pantry sites are not able to do that, so we are continuing to pre-pack for probably around 5 or 6 sites they're a little on the smaller side and really aren't able to accommodate that type of structure. One of the decisions for doing so basically was inventory control, as well as the fact that our volunteer numbers are deteriorating. So, you know, we recognize that we've really run our volunteers quite ragged throughout the pandemic, and understand that the burnout does happen. You know, things happen. People get afraid. You know, with the outbreak after Thanksgiving and the numbers the way that they were, it was very difficult to get volunteers into our facility, and had some days where, again, our staff were going out and packing boxes, which is fine. But, you know, sometimes it makes that a little bit difficult to get other job responsibilities done. So volunteers are definitely our lifeline and still very much in need. We ran our numbers for the end of the year, basically comparing them, looking at pandemic numbers from March to the end of December, and over 6.4 million pounds of food were distributed out to our consumers and people that needed it throughout the pandemic. Over 28,000 people, that is unduplicated, people that received services during that time. Over 400 drive-through distributions were conducted. Those were at the food pantries, those were at the fairgrounds, and so on. And over 101,000 physical boxes were packed and distributed out of our Delmont facility. So the impact may not always be in pounds or people, but you look at the work that was getting done and the people that were getting served, and it was quite phenomenal. All of our pantries are open and running. They're still doing drive-through distributions, as I said, at this point. And our Operation Fresh Express program will be returning in March with modifications to allow for low to no touch, maybe drive-through. We're still working on that. It's a little bit of a different program because of the product that is distributed, but no consumer will be reaching into boxes or anything like that, no matter how we set up the distribution. So there's some light at the end of the tunnel in terms of getting more food out to more people, and we're still plugging along. So thank you, and please, if you know of anybody that's willing to volunteer, we could sure use the hands.
Great. Thank you so much, Jennifer. Appreciate that.
Thank you.
Deb Thacker, I believe, is here with Feeding the Spirit. Deb?
Good morning, everyone. Thank you for the opportunity to allow us to share some information. I'm going to mirror what Jennifer says about the numbers are up and the people in need of food are up. And we took a good hard look at our numbers for the year 2020 because things were so different. And what we found was total meals distributed as takeout or drive-through in 2020 was 10,908. That's huge because the former year, in 2019, our meals, when we were doing sit-down meals every week, we distributed 4,407. And at that time, we thought that was a really high number. But now, obviously, we're doing it differently. We realize we're serving more people in a very different way, but we also see there are more people that are coming and more people in need and more families. So we're very happy that we can reach out and touch those people. We continue to do that. We average about 230, 240 meals a week at our Thursday night distributions. It's a drive-through and a walk-up takeout. And right now, most of our guests, they understand, you know, it's not our normal social time, and we're very sad about that, and so are they. But about 70% of our guests now are drive-through. So they get that. They understand the need to be safe, the need to keep our volunteers safe, to keep everybody safe. The other thing we do, we continue to partner with Westmoreland PA Diaper Bank, and we do give out diapers. We give out hygiene items as they drive through. We give out all of the donated items as we can. So we have specific volunteers that tackle that while we're distributing the food. We have a lady who targets the diaper distribution. We have people that do the adult diaper distribution. we try to talk to each family that comes through and say, what are your needs? Do you have an individual need that we can work with? And we take down that information, and then we contact them later, or if we can solve that problem at the time, we do. So we're kind of doing the best we can in every way we can, like everybody else. To touch on the rent, we obviously have seen an increase in rental assistance calls. In 2019, we had 20 calls in December for rent assistance. In December of 2020, we had 93 calls. Just a huge, huge increase, and it doesn't stop. We realize that is not gonna change at all. So we just try to work with all of the other agencies and keep people safe and keep people housed and in their homes. The other one thing I want to make everybody aware of, if you don't know, we've been working with Union Mission and Welcome Home Shelter hand in hand for a lot of different areas, but we provide photo IDs and birth certificate fees for those who come into the shelter or those homeless people who do not have photo ID, so that they may get access to the system for SNAP benefits, for housing authority. And the caseworkers at Union Mission and the workers at Welcome Home, they call us and let us know when those individuals are in need for that. And we're very happy to oblige and do that, so that it's one more way that we can keep people from falling through the cracks. That's about all I have. Thank you.
Thanks, Deb. I appreciate it. A lot of folks don't realize that ID issue is such a big deal, and so I'm glad you all are filling that gap. Thank you. Let's go ahead and shift to Dan Carney. I believe Dan's here. Talk to us a little bit about housing. I'm sure he'll talk about rental assistance as well, since it seems to be a hot button issue. Dan?
Sure, appreciate it very much, and I'll kind of echo a little bit of what was said earlier. As Commissioner Chu pointed out, there is the additional rent relief funding that'll be coming into the county. We recognize that the $10.4 million is part of this distribution formula that represents about 45% of what we could have available to us within the county. So we could have up to $23 million. Again, if we exhaust that 10, being able to go to the state. And as Phil pointed out, part of our work working with that regional task force and trying to advocate at the state level is to keep the policies very similar and easy for folks, so the state does not add additional burden or requirements, so that if we do exhaust that fund and need to tap into those additional fundings, we don't now have to require our county members to jump through more hoops, right? We want to make this as easy and as seamless as possible. So timeline for that, we're hoping if all things go smoothly, here in February, we should be able to get that rolling out. We will work with our partners, as we did with the rent relief program last year, our other housing partners, to get those applications pulled together and have additional opportunities for people to connect. What I would ask now is that if you are getting calls for rent assistance, to please forward them to our organization. We're creating a list of landlords and tenants who certainly we will be looping back to once this program is up and running, so that we can connect to them and letting them know that these funds are available. We also have in the county's response to this funding that was distributed out for homeless prevention services. So if we are working through, even with the moratorium in effect, it does limit how those funds can be distributed, but folks can still be evicted right now for things other than non-payment of rent. And sometimes the CDC guidelines allow still the local judges to make decisions, even if it is a rental eviction. So there's advocacy work going on the back end to strengthen those guidelines to prevent those evictions. But there is funding available to help those folks out as well. So we want to make sure, again, if you're getting those calls about rental assistance, if you can refer them to us, we'll connect them either through our program, the Housing Authority, the other partners that we have that we're working with. We want to keep them housed as much as we can. So more to come on that. We've also increased through the county's efforts some of our other housing responses. So the shelters are up and running well. The cold weather shelter programs are also up and running. So 211 is a great resource to connect folks to those services. It's easy to remember and easy to pass along. And then they'll connect them out to the appropriate contact person to get them, even if the shelters are full, connected to shelter services. We have rapid rehousing programs as well that will be ramping up to quickly move those folks back into housing. One of the biggest challenges that we've seen is the market is a little bit slower, right? So normally in a traditional world, housing turns over on a regular basis. That unfortunately is not happening. So it is taking sometimes a little longer to connect folks back into apartments. And we want to make sure that we can do that as streamlined as possible. But that's really about all I have. The report, if you have questions, comments, concerns about rent relief, please let me know. We'll be pulling together those groups to work through our county's response and making sure that we get that built out appropriately and can help as many people as possible.
Hey, thanks a lot, Dan. And please know that I'll be working, through the Pittsburgh Foundation, the Community Foundation of Westmoreland County on the advocacy and policy side, already talking to legislators to try to make sure that that money gets out into the people's hands as soon as possible with the fewest number of restrictions, as well as addressing some of those loophole issues you talked about on the eviction moratorium. So I may be reaching out for your help on that, but certainly something that we're concerned about as well. So thank you, Dan. Let's go ahead and finish. I think Jordan is with us, who is with the Hill Group. Jordan, are you with us?
I am. Good morning, Phil.
Good morning. Jordan's going to talk to us a little bit about he's met with us for the last, I think, 2 or 3 months now to talk about the human services study that's being spearheaded by the United Way, and we've gotten pretty far along. You want to give us an update?
Yeah, we have. Good morning, everybody. Thanks for giving me a minute here to talk about that study. You've heard from me in the last 4 meetings or so with some updates and some calls for your help, right? Either through surveys or interviews or conversations that we've had with you or with members of your agencies and organizations to help us understand the current state and project the future state of human services in Westmoreland County. Together, we are approaching a final set of findings and recommendations, but it's not too late. They are still malleable and they are still adjustable. And frankly, we still need your help. So if anyone on this call is interested in weighing in on the current state, how are we doing today, strengths, weaknesses, good, bad, ugly, on human service delivery in the county, that's at the county level, the provider level, accessibility level for our patrons and our clients, then I'd love to hear from you, either by phone or email, or we can deploy another survey, whatever works for you. But we're also interested in that future state. What are we trying to build together in terms of a system that is going to be everything that it needs to be? Working with you all and working with the steering committee, right? We are shooting for a human services ecosystem in Westmoreland County that is accessible, adaptive, equitable, high capacity, integrated, and trauma informed. And we know there are some barriers and some challenges to making all of those things happen. And so what we will be delivering over the next few weeks are our recommendations built in partnership with many of you that will are intended to do 3 things. Number 1, recommendations to help improve the system overall, structures and infrastructure within the county related to human services. Number 2, recommendations to improve provider capacity. Many of you have said, and many of you are doing the best darn jobs you can given the resources that you have. And so how do we enhance provider capacity? There will be some recommendations about that as well. And then finally, we know there are some overall barriers in Westmoreland County to client accessibility in various locations throughout the county, transportation throughout the county, and those sorts of things. And so we'll be recommending some ideas to think about enhancing accessibility as well. So those 3 things, system, provider, and access, will combine to form some recommendations that we hope will help to improve the ecosystem. But again, if anyone would like to participate, please give me a call, give me an email, and we can talk through that in more detail.
Great. Thank you, Jordan. I appreciate you joining us, and I appreciate that update. I know I'm really excited to sort of dig into the final report. I know we're getting really close. So thank you very much. I think that rounds out our speakers for today. Just a reminder that at the very bottom of the screen there, you can see the tiny URL. If you're looking for some of those resources we talked today, that tiny URL leads you to the county site where all of those, where some of those resources live. If you have questions, again, feel free to go ahead and put those in the question box there, and we'll get those answered from the various panelists and get that sent out to you in the next couple days here. Alyssa, before we wrap, is there anything else from the United Way that you wanna add?
Nope, this has been a lot of great information shared, so I really appreciate everybody taking the time to present and to listen in, and that's all I have. Thanks.
Great. Yeah, I agree. Super helpful today. Well, thank you all very much to our panelists and to those that are on the call. Thank you for the work that you do in the community. Let's keep working together. And we will reconvene again in February 11th for our next meeting to continue the communication. Thanks so much. Have a great day.
Bye-bye.